I am going to start off. I'm Petrina, and first of all, I just want to say, like, I'm just so in awe of all the amazing women that work at Lakeridge Health that have spoke or are working with us at Lakeridge Health, and it just again really shares for me both the environment that they're creating, but also the advocacy, the push on research, and all of the things that you heard about today. And I feel really blessed to be part of this organization and be part of this team. I'm going to just say a couple words, and then I'm going to hand over to these two because I am in awe of both of them, and I learned so much in just my brief time talking with Susan, and I learned from Umwali every day in my work. I have had an incredible career, and I've been very much supported in my career by incredible women. And when I think about Lakeridge Health and I think about the Durham community that we've been talking about, I think about them as an overlapping. The Lakeridge community is part of the Durham community. The people who come to work at Lakeridge, volunteer at Lakeridge, go home to their communities, many of them in Durham. And so when I think about inclusion and equity and health, I often think about the people who come to work every day and volunteer at Lakeridge Health and how critical it is to think about that, because the same people that work at Lakeridge Health that show up every day to provide care to this community, many of them are going through menopause, many of them are having babies, many of them might be dealing with mental health issues. They may go home and have to deal with domestic violence. They may be, experience trauma in their history, and they come into work every day, and there's things that happen in our environment that may impact them. So you can't have a healthy community of Durham without also thinking about the health and well-being of the people who come to work every day to give care. So it's really an important part of the work I do, the work that the team that I work with does. And I think that's something really important. If we can care for the people who work and provide care, that just translates into care for the ability to be present as a caregiver and support to the people that that come to us every day. I also just want to say I'm a mom, and I'm a mom of two incredibly independent young women, 21 and 23, and both of them either are working, one's in medical school, the other one is going to be an amazing teacher, and my second daughter has had her own health journey. She has had health conditions, she's been a patient, she's struggled with mental health, and when I think about an inclusive environment and a healthcare environment, I want to make sure that that environment is a place where they can work and thrive, and that they can be their full self. And so much of the work that we do at Lakeridge is, again, trying to create that environment, as Cindy said at the beginning, where I belong and I can be my full self, and also that all the patients and community members that come can feel like they can see themselves and that they belong when they come to get care here. And I'm going to hand over to my colleague, Umwali, to say more about that.
I was going to try and sit. It was not going to work out. So here we go. So I want to thank everybody who's shared all the expertise and thank the room for joining us today. If we could take a moment and see that actually this room would not look like this 20 years ago, 40 years ago, 60 years ago. We're standing on someone's shoulder, each one of us here. So I'm holding this space for us, for the past, and for the future generations. Loved those cries. I was like, all right, I'm doing this for you. So here's to the future generation. So I'm here to talk about IDAA. And, on a broad scale, IDAA is here to make sure that everybody who comes to get care at Lakeridge Health feels welcome, regardless of what their background is. I'm here to say that everybody who works at Lakeridge Health has the capacity to be their best. It doesn't matter what their background is. And I'm also here to say that our commitment is to make sure that Lakeridge Health is a fair and just work environment, as well as a space where people come to receive care. Broadly speaking, that's our goal. Now, why it matters to you? It matters to you because as women, we're not a single story. And we've talked a bit about some of those examples. That intersectional identity matters. That intersectional identity also calls us to action to make sure that anytime we have an opportunity, that we're able to bring people along, but not only people who look like us or who we can relate to, but to everybody, and also to learn from each other. But here's what a room generally looks like. Even though this room is beautiful with all these women, the statistics would say that in 2022, violence against women increased by 27%. We do work in a workplace that is primarily women. So let's hold that. Secondly, the wage gap between women and men is 84 cents. But when it is a Black woman, it is 69%. When it is an Indigenous woman, it is 67%. When it is a newcomer to Canada, it goes even lower depending on their work conditions or their industry, but we're still looking at potentially around 59 cents. 42.7% of Canadian physicians are now female, yet they remain underrepresented in women's leadership. Only 13% of women are system leaders. Graduate 42.7%, but we're at 13% in terms of hospital system leadership. In academic medicine, just 20% of department chairs and 18% of medical school deans are women. We have work to do, but that's okay. This is where we come in. Yes, this is where we come in. All right. So IDAE, some of the work we do, so we could talk broadly, but on a practical scale, we're invested in equitable hiring and promotion. And so we are part and working in partnership around talent management strategy to make sure that we're looking at the metrics of who's getting hired, who's getting promoted, so that we make sure it balances and it's proportional to the communities we serve. We're also in the process of supporting a leadership development program that will be looking at mentorship and sponsorship, so that for some of us who don't have families and connections that would have given us opportunities to progress, have at least an individual, peers, or a sponsor to support our growth, our career growth. We want to make sure that we're creating a workplace that is flexible and has inclusive policies. That means we're looking at hybrid workplaces, we're looking at other retention mechanisms that will make sure that you can feel seen, feel heard in the workplace, but also what was mentioned earlier in terms of when you come to get care, that we have the capacity to see you. We're also looking at how are we going to measure the work we're doing. So what are our accountability systems and metrics? So that includes things like our performance system. We're now asking questions about equity. That looks like redesigning our complaints process so it's more nuanced to be able to pick up complexities, especially around discrimination, whether it's gender discrimination, whether it's around sexual orientation, the list goes on. We're also implementing human rights services, which will make sure that we now continue to adhere to the Ontario Human Rights Code. So, what's my call to action for all of us? In my culture, we talk about women are the pillars of society. And then I don't know how many of you would have seen campaigns that would say, educate a girl and you're educating a nation. So I really believe in the power of women. I believe in the power of you in this room right here. And so my ask is that we continue to lead with purpose and authenticity. So stay true to yourself and lead with courage. The second one is continue to build strong networks. We need each other, and that is the one thing that is quite special with women, our capacity to build coalitions and collaboration in moving forward. Embracing lifelong learning. That is the work we're hoping that will allow us to continue to grow and to make sure that we be curious about each other in order for us to be the best versions of ourselves. Challenge the status quo. Remember, you're here because somebody challenged the status quo. So now the baton is on to all of us to try and do that. And then lastly, recognizing our strengths and take risks. So one thing that's very interesting is that for many women to consider a position, they generally would like to have over 100% of the qualifications that are needed. And that's not always the same for the male species, if I would say. So anyway, in conclusion, I do believe that women bring transformative power to leadership. And IDAA is here to dismantle systemic barriers and build a future where inclusion is not optional, but the foundation of how we choose to lead. Thank you.
Good evening. As I said before, my name is She Gathers Flowers by the Water, Gagio Yanela. Susan Byrne-Osso, and I'm a crisis intervention counselor with Victim Services of Durham Region. I'm here talking to you tonight on the 19th anniversary of the passing of my Nan, who brought 16 children into this world, 13 of who survived. I'm one of 39 first cousins from the beautiful tropical island of Newfoundland, very proud. And if she were here tonight, she would probably be pretty interested that I'm in a ribbon skirt and that I identify as Mi'kmaq, because she did not have the capacity or the ability to identify as a Mi'kmaq woman. Her father, who was also Mi'kmaq, did not have the capacity to identify as a Mi'kmaq man because it would have affected his trade in the fish industry in Newfoundland when he was alive. And so I'd like to think and I know she's here watching me this evening on St. Patrick's Day, because she really loved this holiday and she passed away on this day on purpose, so we'd never forget, that Rose would have a few things to say about all of her insides falling out after having 16 children and about the way she navigated the healthcare system in Newfoundland. But I'm speaking to you tonight as a woman who lives with a physical disability. I'm speaking to you as a woman who lives with a rare genetic anomaly of the ATP1A2 gene, who in 5 databases worldwide they could not find. I'm speaking to you as an Indigenous woman of a mom of a kiddo who had her first TIA in 2019, and when I was at the workplace, I got a call that my child had had a stroke, and they rushed her to your Lakeridge Health Oshawa facility because they thought she'd had a stroke. And I'll never forget the paramedics that stayed with her until 10 o'clock at night. And I'll never forget the doctor who called sick kids after he got off of his shift after she was rushed into Toronto to make sure that my kiddo was okay. But I also won't forget the nights that I go into some of your ED departments and I have to beg a doctor after I'm done screaming at them that my child just needs an IV in her arm to get those medications into her brain to stop the migraine that could potentially take her life. Or when I go myself and I have a similar experience because I just have a migraine, and what you don't know about my migraine is that it could cause a catastrophic stroke and I will pass away. Because there aren't a lot of physicians that know a lot about my rare genetic anomaly. And so after we're done having a few choice words, and I try very carefully to be very patient and very kind, because I know how tired doctors are, and I know how strange your systems are. And I will say, let's have a conversation about it, what it looks like to be in my shoes living with a hemiplegic migraine. And as an Indigenous woman, I have learned something very valuable, and that is one of the most amazing things that I have is a neurologist who also identifies as Indigenous, who adds 15 minutes onto my appointment when he has the capacity to talk about Western medicine. But then the last 15 minutes of my appointment, we talk about my spiritual well-being, my emotional well-being, the diet that I'm supposed to eat as an Indigenous woman that will change the physiology of my brain and my well-being. And I'm also a crisis intervention counselor with victim services. And so I come into a lot of your ED departments with victims of domestic violence who are so terrified to be there that they will give anything not to go. And so as a community partner who spends a lot of time there, I spend a lot of time getting to know your staff, getting to know your departments, being a part of evenings like this evening as a community partner, because that's my commitment to my community, which is to sit here at events like this and to partner with you to help you understand the Indigenous narrative. And that trauma-informed care needs to be at the very center of everything that you do. Not only trauma-informed care for your patients, but trauma-informed care for every one of you that work at your hospitals, that work in your offices, that work in your clinics, because the work that you do too is just as important as the patients that you serve. I can't walk in everybody's shoes, nor can you walk in mine, but what I can ask for is that listening to actually hear instead of responding, even if you don't have the answers. And that's how we walk together in reciprocity, from that very offering of tobacco tonight to my sisters and I, to the ability for us to sit here this evening. It doesn't matter what walk of life you come from, every single person in this room is important. And so I know that my Nan is here with me this evening, and I know that when my daughter was born in 2004, she came to Ontario at 84 years of age. She'd never been on an airplane. You need to understand that Rose was very Catholic, and so she traveled with her rosary beads everywhere she went. And the night that Amelia was born, in a snowstorm in December, she walked into a hospital in Toronto because she double dosed on her warfarin. And she looked at the doctor and she said, "Now, my darling, my granddaughter's out in Oshawa and she's in the hospital and she's about to have a baby and I need to be there for that." So she said, "Give Nan a holy hug and you send me to Oshawa because I know that there are doctors out there that are going to take care of me." And that's what she did. They took the IV out of her arm and they let her go with my dad, and she was at that hospital that night when Amelia was born. And they looked after her while she was there. And so I will never forget that gift that I was given that night. And I think it's really important that we never forget the gifts that we are all given in this life, and that we choose to walk on this journey, and that we choose equity and diversity and inclusivity every day, and that we choose the well-being of our employees, and we choose the well-being of our communities. And if we wake up every day and we commit to that, then I think we're okay. Well, Aliak.